5 causes of constipation you might not know about. Hi there, I'm Dr. Anton, and today we're going to dive deep into a topic that affects millions of people worldwide, constipation. While it may seem like a common and minor issue, constipation can actually be a sign of underlying health issues that warrant further investigation. In this video, we'll discuss 5 causes of constipation to be aware of. Our first cause of constipation is pelvic floor dysfunction. The pelvic floor muscles play a crucial role in controlling bowel movements, and when these muscles are not functioning properly, it can lead to difficulty in passing stool. Do you ever feel like you are straining against a brick wall when passing a bowel movement? Well, this could be a sign of pelvic floor dysfunction, and in particular, a condition called dyssynergia. Dyssynergia is more common in women, especially those who have given birth multiple times or have gone through menopause. However, it can affect all individuals. Normal defecation involves the coordinated relaxation of the anal sphincter complex, allowing for the easy passage of stool. In patients with dyssynergia, this mechanism becomes uncoordinated, leading in some cases to an increase in sphincter tone and subsequent obstruction. Symptoms of pelvic floor dysfunction may include straining during bowel movements, incomplete emptying of the bowels, and a feeling of rectal fullness. If you suspect that you may have pelvic floor dysfunction, it is important to see a gastroenterologist for further assessment, which may include anorectal manometry. Intestinal dysmotility. Intestinal dysmotility is another cause of chronic constipation that is characterized by abnormal movement of the intestines, leading to slowed or impaired transit of stool. This condition may be idiopathic, that is to say there may not be a clear cause, or it can be secondary to other conditions such as diabetes, scleroderma, or Parkinson's disease. Symptoms of intestinal dysmotility may include bloating, abdominal pain, and infrequent bowel movements. Diagnosis of this condition often involves specialised testing, such as a colonic transit study or anorectal manometry, to assess the function of the intestines. Treatment for intestinal dysmotility may include dietary modifications, medications to stimulate bowel movements, or in severe cases, surgery to remove a portion of the intestine, though this is uncommon. Thirdly, psychological factors. Believe it or not, psychological factors can also play a crucial role in constipation. In fact, it's one of the most common causes of chronic constipation we encounter in clinical practice. More and more, we are understanding the integral connection between the gut and the brain. Conditions such as anxiety, depression, and stress can affect the function of the digestive system and lead to difficulty passing stool. This condition is known as functional constipation. Treatment for functional constipation usually involves a combination of dietary strategies, stress management, and treatment of an underlying anxiety or depressive disorder. Gut-directed hypnotherapy in particular is one strategy that has been shown to be effective in the treatment of functional constipation. 4. Medication side effects. Medications can commonly cause constipation. Certain medications, such as opioids, anticholinergics, and calcium channel blockers, can slow down the movement of the intestines and lead to constipation. If you are experiencing constipation as a side effect of your medication, it is important to discuss this with your healthcare provider to see if there are alternate medications that may be less likely to cause constipation. In some cases, a stool softener or laxatives may be recommended to help alleviate the constipation while still taking the necessary medication. And finally, constipation can rarely be a sign of more sinister pathology, particularly colorectal cancer. In particular, a sudden change in bowel movements or associated symptoms such as rectal bleeding or weight loss can be associated with the development of colorectal cancer. If you experience a sudden change in your bowel movements, it is important to consult a healthcare provider to discuss if further investigation, such as a colonoscopy, is required. Early detection is key to ensuring that colorectal cancer can be treated effectively and cured. In summary, constipation can be a complex and multifactorial issue with a variety of potential causes, some of which may be overlooked if not investigated further. If you are experiencing constipation or any concerning symptoms, it is important to seek medical attention from a gastroenterologist who can help determine the underlying cause and provide appropriate treatment. Remember, your gut health is essential to your overall well-being, so don't ignore any signs or symptoms that may be indicating a more serious issue. Note, this video is not a medical consultation. Any medical information is general in nature and is not intended to provide individual clinical advice. You should contact your doctor or other healthcare professional in relation to any concerns they may have, as your own circumstances may be different. Subscribe for more videos on all things gastroenterology, and if you'd like more information or to book a consultation, visit our website.